So what to look for? Obviously, when it gets to this point, it's pretty obvious, glaringly obvious. But what you really want to look for are the parents or the siblings with decay. If you're a general dentist, you know these families well, you know the parents well, you know how much work that you have done on their mouths or their siblings' mouths. And so obviously the younger siblings, the new babies in these families, these are the people you really need to focus on. Even teachers and nurses, if they know a family, every time the mom comes in, she's talking with her hand over her mouth because she's completely embarrassed of the fact that she has holes all through all of her teeth. Those are the families that you really need to talk to. The kids who are constantly walking around when they're 3 and 4 and 5 with pop in their bottle or pop in their sippy cup, or every time they go to McDonald's, they're drinking pop, or the families that come in and they're in your waiting room and everybody's drinking pop. Those are the kids that you really want to focus on, or the juice cruisers. The children with really poor oral hygiene, and anybody with the white spots on their teeth, the demineralization. So a family history of decay, but a mom who has a mouth like this, or like this, you see them, you know that they are super high risk for cavities, and obviously any of their children are going to be in that same risk category. Demineralization, again, it's just the white lines, the white spots that you see along the gum line. You brush that plaque off, and underneath there is all acid etched, just like glass that's been etched by acid. That's the starts of cavities. So once you get them in your practice, now what do? You do a knee-to-knee exam, just like Lisa and Maggie showed you with Eli, and get a good look in there and help the parents get a good look in there. There's no better vantage point for a mom or a dad or a grandma who's taking care of that baby than sitting right across from you with your examination light in there, with your mirror in there so they can see the backs of those teeth, with the toothbrush so they can see any bleeding or plaque or inflammation, anything that's going on in there. They're right there, and it's probably one of the best vantage points that they've gotten, maybe since the child has gotten teeth in their mouth. Really talk about diet, all of those recommendations that we talked about as far as sugar and acid and good snacks and bad snacks and frequency of the sugars and timing of the sugars. Hygiene, again, it just goes all back to what the hygienists were talking about. Optimal fluoride, caries risk assessment, any necessary radiographs that you may need. Do they need a prophy? Do they have a lot of stain? Is there so much thick, sticky plaque on there that you really can't get underneath it with your toothbrush? Then you need to do a little prophy, just a baseline prophy, so that you can see what's underneath there, because sometimes you get that sticky yellow plaque off of there and it's all decayed underneath there. And then fluoride varnish. And sometimes we need to step in and do the little burr outs. Maybe it's a 15-month-old or an 18-month-old who only has a few teeth in their mouth, but they've got cavities on the 4 front teeth. Obviously you're not going to plop them down in your chair and do resins. But the parents want some kind of fix. Their teeth that are supposed to be in their mouth for a number of years. So we use the atraumatic restorative technique. We get in there and we burr it out. We maybe place a temporary filling in there, see them back with those high-risk protocol frequencies once a month for 3 months, and get them on track so that this doesn't progress to a point that we need to extract the teeth. And yes, it is that easy, and this is one of the families in our practice, and we actually put the siblings to work to show us how easy a knee-to-knee exam really is. And again, this is just the vantage point, the parents and the grandparents, and even if one parent is holding the child and actually doing the knee-to-knee with the doctor or with the hygienist, and another parent is there watching because it's their first visit to the dentist and they have their camera ready to go, they still have a really good vantage point as well. And you get in there with that toothbrush and just see what's going on in there. And this is one of our success cases, and I think we saw this child originally probably around 18 months, and they had that significant demineralization along the gum line, and it was actually starting to cavitate through, and we went in and we burred it out, we placed temporary fillings, we saw them on our high-risk protocol, and now there has been migration of the demineralization. There's nice, healthy enamel between the decay and the gum line. We didn't have to extract these teeth, and we didn't necessarily have to do resins on them either, at least not at that point in time. When it becomes a big aesthetic concern and everything as far as risk is under control, and if the mom or the dad really want these things filled, now they're 3 or 4 and we can actually go in and do a restoration and have them cooperate enough to make them look beautiful, but the caries process has been stopped, and it's not active decay. And the high-risk protocol they went over, but frequent visits and checks, once a month for 3 months, then every 3 months, and then they can go on to your regular every 6-month visit. And the fluoride's recommended every time we go over diet and hygiene. And what are you doing at bedtime? And what are they snacking on? And what are their regular drinks throughout the day? Revisit it every time, because the more they hear it, the more likely they are to comply with it. And collaboration is the key.